The kidneys are two bean-shaped organs located at either side of the body. They filter the blood of the toxins and send them to the ureters. What is urinary tract infection? Urinary tract infection, more commonly known as UTI, is quite self-explanatory in its names, but most people think that it is just limited to the urinary tract itself. If you are one of those people, then stay with us, because that is not the case. The urinary system makes up of your kidneys, ureters, bladder, and urethra. The kidneys are two bean-shaped organs located at either side of the body. They filter the blood of the toxins and send them to the ureters. The ureters are two tubes that run from the kidney to the bladder. They contain urine from the kidneys. The bladder is the structure of the body that holds the urine until it flows out of the body. The urethra, a duct, passes the urine out of the body from the bladder during the process of urination. Most of the time, the infection is focused mainly on the lower urinary tract, which includes the bladder and the urethra. The infection is painful until it is focused here. However, if it spreads to the kidneys, it is relatively dangerous to a person's health. UTI mostly occurs in females and is treated with antibiotics. The UTI presents itself with visible enough symptoms that are easy to detect and catch. If you have UTI, you are likely to have a pressing urge to urinate frequently, in small amounts, and urination causes a burning sensation. The urine is also likely to be discolored. You may notice that it is cloudy and is pink, red, or black with red copper undertones, like that of cola. This is a sign of blood in the urine. If you are a woman, you may notice pelvic pain mainly at the center of the pelvis and also at the pubic bone. UTI has three types. The infected part of the urinary system determines the type of infection you may have. UTI affecting the urethra is called urethritis. It causes a burning sensation during urination, and a discharge is often seen with it as well. UTI targeting the bladder is called cystitis. It causes pelvic pressure and discomfort in the lower abdomen, frequent and painful urination with blood in the urine. UTI affecting the kidneys is the most dangerous. It is called acute pyelonephritis. The symptoms include high fever and chills with vomiting and nausea. You may also experience upper back and side pain. UTI occurs when bacteria enter the bladder via the urethra and begin multiplying. Although the urethra has a protective system in place, the bacteria sometimes invades and settles, causing a full-blown infection. For the most part, it is females that get affected by the UTI, and the most affected areas are the urethra and the bladder. UTI of the bladder, a result of the E. coli, is found in the gastrointestinal tract of all humans. Sexual activity may also cause it. However, women generally are more susceptible to it due to their anatomy, the closeness of the urethra and the anus. In UTI of the urethra, the infection results from E. coli but from the anus to the urethra. UTI is more susceptible to women due to four main areas: their anatomy, menopause, certain types of birth controls like the spermicides, and sexual activity of women. A suppressed immune system can cause you much harm, including the development of UTI. A black urinary tract or abnormalities in the urinary tract, use of a catheter, or a recent injury procedure can put you at risk of developing UTI. Prevention includes drinking lots of water and cranberry juice. UTI is treatable, so should you experience any symptom, get yourself checked by a doctor.